In 1865, an American diplomat named Ephraim George Squier stood in a museum in Cusco, Peru, holding a human skull. The skull was ancient, Incan, at least 500 years old, and it had a hole in it. Not a wound, not decay, a hole, rectangular, roughly an inch across. The edges were so clean, they looked machined. Squier was not a physician, but he knew enough anatomy to recognize what he was seeing. Someone had cut into this skull deliberately, and the bone around the opening had healed. The person had survived. Squier brought the skull back to New York and showed it to leading surgeons. Most refused to believe it. The cut was too precise, the survival too improbable. Surely it was a fake or a post-mortem mutilation, misread as surgery. Then came Paul Broca, a French physician, an anatomist, one of the most respected scientists in Europe. Broca examined the skull carefully. He studied the bone regrowth. He calculated how long healing would have taken. His conclusion was unambiguous. This was surgery, performed centuries ago with stone tools on a living patient. And the patient lived long enough for the bone to regenerate. And this skull was not unique. Within decades, archaeologists began finding trepanned skulls across the world. France, Russia, China, Kenya, Bolivia. Skulls dating back 7,000 years. Some with multiple holes. Patients who survived one surgery and returned for another. By the 20th century, the evidence was overwhelming. For thousands of years, across nearly every inhabited continent, humans had been deliberately opening the skull, not as punishment, not as ritual sacrifice, as medicine. So the question remains, why would rational people drill into the human brain, and why did they keep doing it? To understand trepanation, you have to abandon the modern brain. We know the brain as an organ, electrochemical, measurable. Ancient physicians did not. What they knew was the skull, bone surrounding something vital, a container. Illness was physical. Headaches were pressure. Seizures were intrusion. Madness was something trapped inside, fighting to escape. This was not metaphor. It was observation. If sickness was caused by pressure, by build-up, by something that did not belong, then relief required release. The skull was the barrier. Opening it was the cure. This reasoning appears in the earliest medical texts we have. Hippocrates, the Greek physician whose name we still invoke, wrote explicit instructions for trepanation in the 4th century BC. He described when to operate, where to cut, how deep to go. He warned against cutting the meninges. He recommended specific instruments for specific fractures. This was not folk medicine. It was systematic, technical, taught. Here is the part that unsettles modern physicians. Trepanation often worked, not because of spirits, not because of humors, because of trauma. A blow to the head causes bleeding beneath the skull. Blood pools, pressure builds. The brain, with nowhere to expand, begins to die. This is called an epidural hematoma. Without intervention, it kills. Modern neurosurgeons treat it the same way ancient ones did. They open the skull. Ancient surgeons did not know the mechanism, but they knew the pattern. Head injury, worsening symptoms, intervention, sometimes survival. Archaeologists can see this in the bone itself. When a patient dies, the cut edges remain sharp. When a patient survives, the bone remodels. In some Peruvian collections, over 80% of trepan skulls show significant healing. These patients lived for months, years, decades, and survival rates improved over time. They were learning. This was not desperation. It was iterative medicine. Trepanation persisted because it satisfied medicine's earliest criteria: visible cause, observable intervention, observable outcome. Some patients recovered, enough to justify the risk, enough to prove the logic. Success was remembered. Failure was explained away. When the patient lived, the intervention was credited. When the patient died, the disease was blamed. The treatment remained unquestioned. This is how medicine persists before measurement. Trepanation forces a realization modern medicine prefers to avoid. Ancient people were not stupid. They observed, they tested, they refined, and sometimes they were right. The horror is not that they drilled into skulls. The horror is that they had reasons. The skull square, carried, now sits in a museum, a curiosity, but it is evidence of something uncomfortable. Someone cut into a living person's head, and that person survived, not by luck, by skill. Trepanation was not madness, it was medicine, before medicine knew what it was treating, and the line between the two is thinner than we like to admit.